So, welcome to the third and the final of our interactive panel sessions this afternoon. And the theme for this session, which flows very nicely from the last two sessions, is the global commons, the contribution of all sectors to protecting the future health of people and of planet. And this session, again, is so rich with experts. We have Dr. Keith Martin, who's the Executive Director of the Consortium of Universities for Global Health, which is based in Washington. We have Dr. Mark Hyman, who's Head of Strategy and Innovation at the Cleveland Clinic Center for Functional Medicine, and he's Board President of Clinical Affairs at the Institute of Functional Medicine. We have Mandeep Dhaliwal, who's the Director of the HIV Health and Development Group at the United Nations Development Programme. And we have our very own Shannon Vallor, who's a Professor and Director of the Centre for Technomoral Futures at the Edinburgh Futures Institute here in Edinburgh. And chairing the session today is Lord Nigel Crisp, who will be known to many of you as well. Nigel is co-chair of the All-Party Parliamentary Group for Global Health and also co-chair of Nursing Now. And Nigel's a former permanent secretary of the UK Department of Health. And it's important, I just want to mention that Nigel's co-chair of Nursing Now because this morning we were delighted that Professor Tlo is Nigel's other co-chair in Nursing Now, and to have that connection. So Nigel, thank you, and over to you.
Thank you very much indeed, Liz, and what a privilege and a pleasure to be facilitating such a panel as we've got here, and who are bringing, I think, quite diverse perspectives to the issue, which, as you say, is the contribution of all sectors to health. Let me just take a moment to say a little bit about context. The context is obviously, we all know that other sectors, whether it's food or employment or education, play an enormous role in health. But of course, in the context of COVID, we have got in this country the sort of build back better. We're talking about a green recovery. And I noticed Felicia Noel talking earlier about dealing with a syndemic, not just a pandemic, that it was not just relating to health disease, but to a much wider set of social issues. And Liz, I know, has asked us to reimagine health, reimagine the future in that much wider context. Let me make just a very quick personal comment. Partly through working globally, because I've spent the last few years working very largely in African countries, I recognise that we should be thinking about the causes of health as well as the causes of disease. And I think now about health in terms of three things: services, prevention and promotion, the causes of disease, if you like, but also the causes of health. And the other sectors, of course, can do so much more in that area of the causes of health, as well as tackling the causes of disease. And one of my favourite expressions I use a lot is one from my great friend Francis Maswa, who used to run the Ugandan health services. Health is made at home, hospitals are for repairs. So with that note, what we're going to do is we're going to take each panelist in turn and ask each of them to give a 2-minute reflection on their thoughts about this great issue of the contribution of all sectors. And I'm delighted we're going to start with Shannon Vallor. Shannon, please.
Thank you, Nigel, and thank you, Liz, for bringing me on to talk about this today. So the pandemic is teaching us many lessons, most of them very hard. But one of the most powerful is the extent to which nations and peoples are now linked together in relationships of techno-social interdependence so complex as to make our 20th century understandings of social health and security woefully inadequate to our lived reality. Through high-speed travel, international trade and innovation, global supply chains, climate impact, and the 24/7 exchange of data expressing truths, lies, conspiracy theories, and culture at the scale of billions and the speed of light, virtually every component of human well-being is now vitally dependent on these planetary networks of influence. And yet we remain mired in outmoded political and economic philosophies that frame social progress as a competitive race among nations, a zero-sum game in which peoples and regions advance in well-being only by outperforming their neighbors, despite the reality that through these planetary networks of influence, we end up sharing our neighbors' troubles. And we've been living this pattern and suffering its toll in many visible ways over the past year. But in truth, this pattern has been eroding human health for decades. The only way to break free of this pattern, which will only cause more grief and loss the longer we remain enmeshed in it, is to stand back and reimagine human health and security as local expressions of global human flourishing. And human flourishing is more than individual survival, even more than personal health. It's a condition of being well and doing well with others. We're social animals, and our physical health is a direct expression of the health of our societies and how well they do at helping us be well and live well together. COVID-19, as we've heard today, exploits our social ills and injuries, and has been already noted some of the wealthiest countries in the world lost control of the pandemic precisely because their healthcare and economic resources are concentrated in too few hands to allow the broader population to protect themselves from the virus. To be well and do well together is increasingly a global need, thanks to the planetary dependencies created by technology. Yet we lack the moral sense of global community to enable us today to respond to that need. To do that, we have to embrace a new idea of a global commons, not a replacement for our local communities, but a way to care for the goods that increasingly link their fates. Ecological health of peoples and living systems is perhaps the most vital of those common goods. Another is informational health, the ability to successfully represent and understand the world together and use it to shape wise and sustainable policies that protect us all. Economic health, namely the ability to innovate in meeting global human needs sustainably and equitably, is critical. But moral and political health, the capacity to globally distribute and exercise power with care, compassion, and justice, is the resource without which none of these other kinds of health can be secure. Successfully building, protecting, and expanding global access to these common goods is the greatest challenge the human family has ever faced. It is our will and our ability to rise to this challenge today that future generations will rightly take as our measure. Thanks.
Shannon, thank you so much for that. That outmoded thought of social progress is a competition. Hadn't thought of it quite like that, but I get the point absolutely. And then, of course, human flourishing and these other issues. So very wide setting of the issue. Thank you so much. Let me then turn to Keith Martin. Keith. You're mute at the moment, I think.
There you go. We're good now? Fantastic. Thank you very much, Nigel. And much thanks to Liz and Rebecca and the team for putting this together. It's an honor to be here. I come at this from a similar way, but maybe with a little bit of a different angle. I agree completely that health, we need to look at this through the prism of well-being. We know that the determinants of well-being are social, environmental, and political in nature. But if you look, at the COVID-19 pandemic right now and a number of other challenges that the world faces, it is ironic, isn't it, that the challenges that we face, which require multilateral solutions, require international cooperation, whether it's the pandemic, whether it's climate change, biodiversity losses, or a host of other challenges. As those challenges become more present in our lives, as they become more urgent, ironically that the political movement to address those is actually moving in the opposite direction. Whereas the need for multilateralism grows, the actual drive is actually for nationalism. And we see that countries are turning into themselves as opposed to reaching out. This is a significant challenge and also a major security problem for every country in the world. And I think through this conference that Dr. Grant is leading, will hopefully help us to come out of that as to how we as a community, as a global health community, can work together to be able to drive that which can change that. So what are the structures that can change that? I think the first thing is politics, quite frankly, is we don't pay, we meaning the academic global health community, we do not pay sufficient attention to bridging the gap with political structures. We do not pay sufficient attention to understanding what are the incentives for politicians, what is the language that they use, and how we can actually utilize those power structures, utilize the incentives that they have, and the language that they use to be able to actually move them forward. Nothing, I think, actually can move things forward to a positive or a negative way faster than actually good or bad politics. The other part of the equation is that in development, I think if you look at development as a pyramid and you pop the sustainable development goals on the top of that pyramid, the global health community, I think, tends to focus on what we can do to address those particular goals, those sustainable development goals, or climate change targets, or ACHI targets on biodiversity. But if you want to be able to address those targets, if you want to be able to have better healthcare systems, environmental systems, public works, and others, you've got to have a functional, strong public administrative structure that girds that to be able to execute and implement the social goods that you need. In development circles, we ignore what I call the foundation of development, which are the effective public institutions that gird the ability of any country to be able to address those social determinants of health. And by those structures, I not only mean health systems, which we tend to spend a lot of time on, which is understandable, but we neglect justice, ministries of justice. We neglect finance systems. We neglect public works, education, and environment, I think. And in doing so, we do not work on that structure that enables countries to implement the social goods they need. And finally, we also ignore the need for an effective, free and open media as a check on the political systems that every country ought to have. Thanks very much. Nigel, over to you.
Keith, I mean, again, that's absolutely tremendous, and pulling out the real importance of politics, which ties in, of course, very closely, it seems to me, with where Shannon was coming from. And that theme, Liz, I suspect, for this whole conference of, as the need for multinational activity grows, we are becoming more nationalistic. That must be part of the framing of this whole conference, isn't it? Let me, on that note, then turn to Mark Hyman to come in. Over to you, Mark.
Thank you so much. Thank you for having me, and Nigel and Liz. And I just want to start with a quote from Prince Charles, who said, "It is our apparent reluctance to recognize the interrelated nature of the problems and therefore the solutions that lies at the heart of our predicament." And my background is in functional medicine, which is a systems approach to thinking about disease, particularly chronic disease, that is really the science of health. And as I sat in my office for decades treating patients with chronic disease, it occurred to me that I couldn't cure those diseases in my office. Diabetes was cured not in the clinic or the hospital, but in the kitchen, on the farm, in the grocery store, and as you say, at home. And I think from my perspective, the global pandemic of COVID is intersecting with the global pandemic of chronic disease and obesity. In fact, 30,000 people die every single day from diet-related preventable disease, from lack of protective foods and an excess of harmful foods. This was from the Global Burden of Disease study. And the elephant in the room is that unless we address our poor metabolic health as a global community, and certainly is worse in some areas than others, we can't really address the underlying issues that face us in terms of the economy, our environmental collapse, climate, social injustice, academic performance, violence, war. All those things are driven in part and are connected by food, because food is really the nexus where most of these things come together. It's how we grow our food, how we produce it, distribute it, promote it, what we eat, what we waste, the policies that perpetuate the unimaginable suffering and destruction across the globe that depletes our human, social, economic, and natural capital. And so I think, as we look at COVID, we're seeing that the pandemic of metabolic poor health, which in America is 88% of the population, has made the pandemic of COVID much worse. A recent paper published showed that the 63% of hospitalizations in America could have been prevented simply by better metabolic health. We know that those who are obese or overweight have a linear relationship to death from COVID, as well as all those with chronic disease such as diabetes, hypertension, and so forth, that are all really diet-related diseases. And the elephant in the room is that these problems are not siloed. When we look at the issue of food, particularly, it intersects with COVID because those who are metabolically healthy are much higher risk of death. It intersects with climate, because the way we grow our food and the entire food system from end to end arguably is among the number one or two cause of climate change, from deforestation, soil erosion, food waste, transport, refrigeration, factory farming of animals. All of that contributes to climate change and ecological collapse. The economic and health gap disparities we see are also related to that. And so we really have the ability, through looking through a different set of lenses, a systems lens of how to really address these problems holistically and deal with this bigger pandemic we're having of chronic disease, which now kills more than twice as many people as chronic disease. And the elephant in the room is that no one's talking about food, our food system, the policies that drive our current food system. In America, we see that 60% of our diet comes from ultra-processed food, mostly corn, wheat, and soy. And around the world, it's soy and rice and wheat. And I think these crops produce highly starchy calories that are driving metabolic poor health and have led to this pandemic of chronic disease that is crippling economies and challenging communities. It's leading to health disparities and social injustice, even impairing kids' academic performance and cognitive function, and even threatening national security. In America, we have 70% of our military recruits rejected because of poor health and obesity. And I think we have a moment in time to stop and reflect on how to solve these problems in a systems way, to sort of step back and see the intersection of these and ask the question of, how do we create health? How do we create the health of human beings, the health of economies, the health of societies, the health of the environment, and of course climate? And they're all one issue that has food connected to it in some greater or lesser degree in each of these. And I don't hear this discussed very much in terms of our global thinking about how we address these intersecting global issues that affect the health of humans, economies, and the planet. So I feel like this is a moment in time for us to stop and look and solve these problems collectively.
Yeah, thank you very much indeed, Mark. That was great, moving us into another area. A colleague of mine in the House of Lords the other day said that she believed that this was the year that food became political.
Yes.
So I think people are starting to talk about it. We'll come back to that, I think. But let me then turn to Mandeep Dhaliwal and ask you if you would say a few words, please, Mandeep.
Thank you very much. And I'm going to pick up, I think, on a lot of things that have been said during the course of the dialogue today and this session. But just to start with stating the obvious, that human health and the health of the planet are not parallel challenges. They're inherently intertwined. Economies and healthy human beings rely on natural environment, which is the source of clean air, water, and food. And the environmental degradation of air, water, and land has already led to significant loss in biodiversity, changed disease patterns, and contributed to the emergence of new diseases. Climate change, which, thanks to the inaction of the global community, has turned into a climate crisis, affects human health by placing pressure on the fundamental requirements of clean air, safe drinking water, adequate sanitation, sufficient and nutritious food, and habitable environments. Another crisis, growing rates of antimicrobial resistance in humans globally, are linked to factors such as lack of access to clean water and sanitation, poor food safety, and overuse and misuse of antimicrobial agents in humans, plants, and animals. So COVID-19 for me is a syndemic of multiple intersecting crises in the health of humans and the health of the planet. It's a virus that has taught the world, if anything, is that ignoring our problems will not make them disappear. It makes them bigger, in fact. And the threat of a looming pandemic was known for decades, yet we did not act or prepare. And efforts to tackle climate change have been met with similar denial. Disease outbreaks such as Ebola and the COVID-19 pandemic highlight the overlapping drivers of poor health and environmental degradation. The interconnections between health, environment, and other areas of sustainable development, and the need for more integrated approaches, such as planetary health or One Health, are essential if we're going to protect and improve the health of the people and the health of the planet. I just want to end with a reflection on, I was very taken with the title that Liz shared with us, which was Reimagining Health. And I think COVID-19 is really an opportunity for us to reimagine health. The COVID recovery must be equitable and green. Neither inequity or equity are inevitable. It depends on our actions. And the SDGs provide us with the kind of blueprint for the kind of multi-sectoral responses that allow us to once and for all address the determinants of health, many of which have been spoken about in this session. We need to address human health and the health of a planet in an integrated way. It requires coordinated, decisive action and political will. It also requires us to rethink governance for health. Governance for health cannot be the sole business of the health sector anymore. We need to engage key sectors: trade, justice, energy, finance, just to name a few, agriculture, environment, and we need to remove fossil fuel subsidies. And that is a big governance challenge and a political challenge. We need new and renewed partnerships, stronger partnerships between the climate and health communities, which are starting to emerge. We need to invest in preparedness, well-resourced global alert and response system that is predicated and built on actual solidarity, not just the principle of solidarity, but putting principle of solidarity into action. And really all of this needs to be grounded in science and common sense. And that for me is what reimagining health is all about. Thank you.
I love science and common sense.
Sometimes we can't wait for the science, so we have to use our common sense.
No,
Saves lives.
I get that. I think that's great. I'm going to, two of you have concentrated on the environment and food, and two of you slightly more on the political environment we're in. So I'm going to ask two different sets of questions. I want to ask Shannon, Shannon and Keith, sorry, Shannon and Keith, about the food and the environment issues, and who. So leaving aside the political layer, the professional politicians, what should we from the health sector be doing to engage with the people working on food, the people who are impacting us through food and through the environment? And I want to ask the other two, Mark and Mandeep, how we should be engaging with politicians, how from the health sector we should be engaging with politicians and making them work. So turning your questions the other way around, if I may. So let me start with Shannon, and we've only got 12 minutes left, so can you make the answers a little shorter this time? How do we engage? What do we need to do in practical terms? Shannon, please.
Sure, thank you. So I think one of the things that's really interesting to me is the way we've approached many health challenges, including those related to diet, from often this standpoint of sort of the medical model that focuses on individual conditions as opposed to the social conditions. Yeah. So I'll draw a parallel here with the shift that we have made in disability studies, for example, away from a biomedical model of disability to a social model of disability, where we think about disability as not something that's contained and defined within an individual person's body, but that is very much constituted by how their society is built, what sorts of minds and bodies it accommodates, and so forth. And so I think we actually need to do something very similar more broadly in the health domain. And if we talk about food and diet, for example, think about how, and I'm a technology ethicist, so this is where my mind goes. I think about how technology is used to address this health challenge. What we do is we immediately go to the level of individual behavior. Yeah. We responsibilize individuals by telling them they just need to consume more information and data about their calorie intake, what's in their food. We tell them to buy wearables that will monitor these things. Now, these are not ingredients that we should dismiss in a potential solution, but on their own, they will not solve the kinds of health issues that Mark was talking about. If we leave this problem at the level of the individual, we will fail. Yeah. What really needs to be looked at are these broader structural factors, many of which Mark spoke to, about agriculture, about food deserts, about the way that poverty affects diet. And these are the things that we've been neglecting. So I think it just goes back to this point about we have to step back and take that social political systems perspective on all of our health challenges.
Great, thank you very much. Let me then turn to Keith and this idea of how we, from the health sector, can link into the wider other sectors, and particularly food and environment.
No, thanks, Nigel. So building off on what Shannon said, we don't have a knowledge deficit. We have an implementation deficit, right? We've got targets coming out of our ears, whether it's carbon numbers, ACHI targets, and more will come, and we'll be here 10 years from now in the same problem. So we have to bridge that gap. So on the political side, Nigel, to answer your question, the health sector, we need to build bridges with the environmental sector. We need to build bridges with the private sector, but understanding on the private sector that their incentives are different, along the lines of what Mark said, their interest is in making money, right? Making profits, and for their shareholders. Their interest is not the health of their customers. So you're going to have to work on the political side, and we're going to need to be able to mobilize different sectors, work with the environmental groups, the public health, the health groups, and others, bring in associations. We have to have a common message. We have to communicate in a language that politicians understand, which is not science language. We have to tell them clearly what we want them to do, why we want them to do it, what is the cost, and then we need to engage the public. The public, as you know, Nigel, as a lord, the public can move the political. We need to be clever about mobilizing that, and not only using the kind of material we have on paper. We've got to tell stories. We've got to use visuals, and we have to appeal not only to people's minds, but more importantly to their hearts. Emotion moves action, and self-interest can move mountains. So we need to understand that and utilize that.
Yeah, no, great. Thank you so much, Mark. Then the other way around, how should you be influencing the politicians? How can you?
Well, thank you for that question. In fact, I wrote a book as a doctor about policy, which was very dangerous. It was called Food Fix: How to Save Our Health, Our Economy, Our Communities, and Our Planet One Bite at a Time. And I laid out in there solutions that have to come from the grassroots, consumer-driven, from businesses and innovators, from philanthropists, and most importantly, from policymakers. Because unless we address the policy challenges around our food and food system, both agriculture and food, we're not going to be able to solve this. And we don't really have a coherent framework. For example, in the United States, there's, I think, 8 to 11 different agencies, all determining what our food policies are, all of them in contradiction with each other, and not really focusing on how we create a coherent strategy to grow food in a way that regenerates human health and planetary health, instead of being destructive and extractive, which it is now. So we need to, as I learned from you, Nigel, integrate public health and healthcare. I think there's an artificial division between the social determinants and the real drivers of health crises, which is, basically what's happening in the community, in our homes, and what's happening in the clinic. And we need to really drive different incentives that are driving the growing of the right food through, for example, regenerative agriculture, which produces better food that's better for you, better for the animals, better for the planet. We need to incentivize reimbursement for what we know works. For example, food is medicine. Just one quick example is in Geisinger Health System in the United States, they took food insecure diabetics who are costing about $248,000 a year in healthcare costs each, and they provided them free food plus education and support for changing their lifestyle. And they were able to reduce healthcare costs by 80% and improve their health outcomes dramatically. And it literally saved $192,000 per patient. We do not reimburse for food as medicine. We do not have incentives within healthcare to provide training or lifestyle changes. And in fact, at Cleveland Clinic, we're pioneering approaches based in the work you inspired in me, which was to create social group models in the community for behavior and lifestyle change around food and other factors. So I think we have to really look at all the policies that are driving the food system and agriculture system across all sectors, and including how we have policies around healthcare, how we look at marketing and regulation of food, how we look at government programs related to food, nutrition, healthcare, and agriculture, and all these things are sort of outlined in the book I've written. So I think we have a really important moment when these problems are coming to the fore, the intersections are clear, and we have to solve them as one whole systems solution.
Yeah. Let me then turn to Mandeep, but just doing that, I'm going to ask everyone at the end, after Mandeep's finished, to what is your key message to the University of Edinburgh for their principals? What's the one thing we've got to have in there? And you'll get about 20 seconds to say it. I won't give you a word count. And then that allows me 20 seconds at the end before handing back to Liz. But Mandeep, your turn to talk about how we engage the politicians. How do we move the politicians?
I think, in terms of engaging the parliament, there's one message which I think just bears repeating over and over again, that the health of humans and the health of the planet are an investment. They're not a cost. And I think there's been a lot of work on framing health as an investment over the years in the academic space, but I think that message really, COVID has certainly driven that home, but I think that's a message that's very important. The health of the planet, which is fundamentally linked to human health, similarly must be seen as an investment and not as a cost. And we've talked a lot about social determinants, but there are three sets of determinants which really influence both the health of humans and the health of the planet, which we don't talk about enough, perhaps because they're sensitive issues. And one is political determinants, and that's the issue of political will. Yeah. The other is legal determinants. What are the laws and policies and legal frameworks that are in place? And then the commercial determinants. And I think all of those need to line up. And often these political determinants, inaction is sadly often the case. People say it's too difficult, don't want to address it. Legal determinants, again, law and policy, difficult to change, but there's lots of work out there which can advise it. And commercial determinants, which I think are really, really ignored. And Mark's given some brilliant examples of, the impact of commercial determinants on human health. And so I think we need to look at determinants holistically. And we need a system that allows us, a systems approach that allows us to look at all the determinants. And for me, one of the big lessons is we have to move away from this false proposition of trade-offs. There's no trade-offs between human health and the health of the planet. What we need are tipping points, and we need to move to sort of high-impact action and investments that allow us to address the determinants so that we can really unblock some of these challenging issues. So I'll stop there. Thank you, Nigel.
Mandeep, thank you. Moving from false trade-offs to tipping points. I hope whoever's listening from the University of Edinburgh is getting down some of these great expressions that are coming out of this panel. But let me just then try and get us to finish off by just saying very briefly, what's your one core message, in your case, Shannon, to your employer, I guess, that we want to see coming out of this conference, and then to Keith and in the same order as before. So to you, first of all, please, Shannon.
Thanks, Nigel. It's actually quite simple. It's to teach the next generation of leaders how to work together to reintegrate scientific, moral, and political wisdom into what used to be called by the Greeks practical wisdom, which is what we need today to manage the challenges that we've been talking about.
Fantastic. Yeah, thank you. Keith.
Share the knowledge that you're producing both with politicians and the public, and in the relationships you have with international institutions, work with them to build their capacity to be able to strengthen their ability to implement what their countries need.
Great. Thank you very much. Tremendous. Mark.
I think the ideal scenario for me would be to create a think tank that would bring together multiple stakeholders across all sectors of politics, business, individuals, and look at how we address the intersection of all these issues that we face: chronic disease, ecological collapse, climate change, social injustice, economic burdens, and many of these global crises that are interconnected, and create literally a food think tank that helps to solve these problems by identifying them and bringing in the right stakeholders to solve those issues.
Great. Super. Thank you very much indeed. And Mandeep.
I think for me, the one big lesson, and this is how I've learned the most about climate and the climate crisis, is listen to young people. And listen to your students, because I think they have so many of the solutions. They think about things in fundamentally different ways, usually not in silos, in the way that many of us have been trained to think. So I think listen to your students. I think you will be surprised at how many of the solutions come from their ideas, their way of thinking, and their experience. I'll stop there. Thank you.
Thank you, Mandeep. That's fascinating. I know that chimes in with where Liz is coming from, I think. I'm going to take one final word, which is that there's a concept which Shannon introduced at the beginning, or snuck into her presentation, of human flourishing. I think is great, because I think it's both about health and about prosperity and about how we live our lives. And frankly, it's as old as Aristotle, and it's as recent as the latest bit of medical research, which shows how relationships improve health, our social relationships improve health. And I think it's the sort of area we should really be thinking about for the future. And on that note, Liz, I'm handing back to you, and I've got 22 seconds for you.
Thank you. And in those 22 seconds, can I just say thank you so much for that outstanding panel, and for giving us at the University of Edinburgh, giving all of our listeners, our audience, all of us together, guidance, thoughts. You have really set the tone and set the scene for taking these Edinburgh conversations forward as well. So thank you, Nigel. Thank you, Shannon. Thank you, Mark. Thank you, Mandeep. Thank you, Keith, for the time that you've given us. And we look forward to the think tank of the future for practical wisdom. And you'll hear from the students, because you're right, the students are bringing us new insights. They're actually showing what reimagined health would be. They're showing how to build capacity in a sort of equitable way, using the data we have, using and marrying that interdependence and interconnectivity of human health and the health of the planet. So thank you, Nigel. That was an honour to have you here as well.